Hi, my name is Dr. Melanie. I'm a chiropractor at Venture Chiropractic, and today we're going to be talking about torticollis. Torticollis is a fairly common condition that can affect any age, but we are going to focus on babies and children. It is a condition where the SCM muscle, the sternocleidomastoid, attaches at the base and then down to the clavicle and the sternum. And when that muscle is shortened or contraction, it causes the head to tilt to one side and rotate to the opposite side. This shortened contracted muscle causes a variation or a difference that increases. You may notice one shoulder higher, and it really affects head control and movement. It is something that it is very important to get addressed properly by a medical professional to make sure you know what's going on and how to continue, because it can have some long-term effects for your infant. There are two types of torticollis, congenital and acquired. Congenital is more common and it occurs in about 1 in 300 children, or infants, I should say. You may not be aware that it's there until they start getting a little bit older, around 4 to 6 weeks of age, when they should be having better head control and being able to hold their head and turn in both directions, tilt their head, engage with the caregiver, look at toys, they hear noises and they turn. And if you start noticing that they are just caught looking in one position and they're having a difficult time engaging in the other side from where the head is, the SCM muscle or the tightness is, that is something that, again, we can look at a little bit further. Looking at pictures can be a useful tool as well. We are with our kids all the time, so we sometimes don't notice these little differences. In some cases, it may be other family members or friends that make a comment, or you're taking pictures of your little one and then you start noticing that they are always tilted to one position. It will cause a decreased range of motion of their neck because they're only able to tilt and turn in that one direction. It typically is painless for them. They just don't want to turn, of course, into the opposite direction, and they will fuss or resist your movement if you do try to move them in that direction. The congenital torticollis, you may also notice facial asymmetries, flatness in the back of the head forming, differences, increases on the eyes, creases in the mouth, creases in the nose. The creases can tell us a lot, so being aware of what your child looks like can be really important in determining what type of torticollis that they have. Acquired torticollis is the second type. This typically happens and is identified within the first 4 to 6 months of life. They will also have that shortened SCM muscle tilt with an opposite turn presentation of their head and decreased range of motion. This can be due to various positions that that child is in throughout those first few months, whether they're in containers more than being held, tummy time, and such. We will definitely go into more details of what to look for and what to do in future videos. So stay tuned for more details on that. Getting a little bit more into the causes that can form this torticollis. And just so you can kind of see a visual too, back here, this is the SCM muscle. It anchors at the base of the skull down to the sternum or breastbone and the clavicle or collarbone. It's a very long muscle, and you will see this head tilt presentation for your child. The back of the skull. This is another area to look for, and it can tell us that something is going on with either the muscles or the joints and how your baby's neck is moving. We do want to make sure that for baby positioning, that we are cautious and aware of what's happening when we're feeding our child. If the baby is always being fed, whether it's bottle or breast, more on one side of the body, that can cause those muscles to tighten a little bit more on that side. If babies are always in a container, which is a car seat, one of the little like sit and play stands, that will also, when they do not have head control to properly hold their head tends to tilt to a side. Gravity pulls it over, promoting more of that tilt and tightening of that muscle. Baby positioning in birth. The pelvis is definitely equipped to be properly positioned for a baby, but as baby enters the pelvis, how their head is to the bony pelvis, and as it enters in through the pelvis, getting ready for birth, that can cause a prolonged position for baby's head being stuck in that side tilt with an opposite turn position. breech, transverse lie, which is babies laying more on their side during pregnancy, shoulder dystocias, where the shoulder gets caught during birth, can also be some issues that cause changes in the musculature and the joints of that baby's neck. It is also important to know with a torticollis or a head tilt to make sure the hips are evaluated and checked properly as well, because you may see a hip dysplasia, for example, be present along with the head tilt that we are focusing on today. Visual problems. As the baby's head tilts and turns, they are more aware of their environment on the side that is more up. They may use this hand more often. Their eyes may start tracking and picking in information from their environment more on this side. And you will start to see less movement of the limbs on the shortened side, and the eye will not move in the same direction or equally as we see on the side that has more length to it. That is something that is really important to watch for. If their eyes are also having a deeper structural issue, an eye doctor can evaluate infants properly for this as well. That can cause their head to tilt if they are not able to see properly from this eye, this field of sensation and awareness of their environment will develop faster too, also having a head tilt. Firstborns, moms are a little bit tighter. The uterus muscles don't allow babies to move around as freely as consecutive children. So we may see more of a torticollis with firstborns. Larger babies, they just have limited room to sometimes move. So they can also have some challenges with equal or symmetrical head movements. Tongue lip ties or oral restrictions are also something that can cause some head tilting. The tongue, like the rudder of a boat, can direct where that head moves. And if we're getting tightness around the neck, tongue, or lip, the frenulums or the structures inside the mouth, that can also cause your child's head to tilt. You will see this in feeding and some other challenges as baby continues to develop, but it's really important to have that properly evaluated. And then congenitally, there are some genetic conditions that can lead to these head tilts performing that your medical professional should be able to help you with. I can't stress enough that you might be able to identify just visually that a head tilt is present or that torticollis is there, but knowing the exact cause and reasoning why that torticollis is developing is extremely important to identify. An occupational therapist, a chiropractor who is trained in pediatrics and identifying some of those joint and muscular restrictions can be helpful. Physical therapy, and then speech pathology or oral myology can be vital in helping your little one get the proper diagnosis and proper treatment plan laid out so that they can improve and continue to experience their environment fully as they develop. I will continue to discuss a little bit more in the next video, some of the red flags to look for, how we diagnose in the office, and some things that you can do at home. So stay tuned to those videos. If you like what you see, like the button and subscribe to our channel. You'll see many more of these videos coming towards you. Again, I'm Dr. Melanie with Venture Chiropractic, helping you move better, feel better, and be a better you.